I've been in voice lessons since 3rd grade. I'm still in voice lessons. The plan is science. The absolute plan is to go into science and be in industry in some way, shape, or form. However, Brian May, the lead guitarist of Queen, has a Ph.D. in astrophysics. So if by some miracle after I graduate, because the doctorate comes first, I get offered to be a rock star, so I'd still, switch to that. My name is Chelsea Marks. I am in MCD biology at the Graduate Center. I'm in my 4th year. My mentor is Karen Hubbard. Her big thing is inclusion in cancer research. I've been a cancer researcher for forever, specifically breast cancer. That's why my hair is pink. So Dr. Hubbard's lab is focusing on triple negative breast cancer. It's a specific type of breast cancer that is very hard to treat because usually in breast cancer, your first line of defense is a hormone therapy. What the triple negative means is that no hormone therapy can work with this. It has a much worse prognosis and is much more common in women of color. So we're looking at a new chemotherapy that's based on the metal ruthenium and testing out if it works on breast cancer, which it does appear to, and why it works. In order to get a drug to clinic, FDA type people like to know exactly why a cell starts dying from the cancer. I was very set on being a Broadway star. I was gonna be a singer with my name up in lights. And then I was diagnosed with a form of neurodegeneration muscularly that we nowadays know as a form of juvenile ALS, which is a more mild version of the same disease that Stephen Hawking had. The disability that I was born with, the legal blindness, is a pain in the butt. Let me not kid you. I have to work way smarter. I honestly think that science is making a huge detriment to itself by not having people with disabilities in it more often. I was in and out of the hospital constantly, and I kept on asking questions about my health, and essentially they kept on saying, "We don't know." So it annoyed me, and I wanted to be the person who found out the answers so we would know. Fast forward to 11th grade, my mom was diagnosed with breast cancer. And I was an AP Bio at the time. So after class, I went up to my teacher, and the cancer unit coincidentally happened to be within a couple of weeks of my mom's first surgery. And I asked a whole bunch of questions, and my teacher kept on saying, "Chelsea, we don't know. We don't have the answer yet. Cancer plays by its own rules." So from that moment on, I decided I was going to be the one to find the answer, because I thought it was unfair that other kids had to go through cancer themselves or have a parent go through cancer. It seems unnecessary and unfair, and I wanted to figure out how to stop it and why it's happening. That if I can help just a small number of women live just a little bit longer, to have a little bit more happy memories with their family, that would be enough. Would awards and accolades be great? Sure, but helping real people is just so much more important to me. I know what it's like to be on the patient bed, and I want to make as few people need to be there as possible. It's not a fun place to sit. I want to go into industry nowadays. I want to do the research and development department of a pharmaceutical company, come up with new drugs that if a new drug hits the market, I can point to it and be like, "Hey, I worked on that and like be proud of myself for that.